Should everyone be taking vitamin D supplement?
You mean everyone on the planet?
Yes, everyone. Should everyone? That's why it's everyone. Everyone.
Oh, I thought you meant like just our viewers.
No. So that's the question we're going to answer today. Welcome to Talking with Docs. I'm Dr. Brad Weenie.
I'm Dr. Paul Zalza. We're not going to answer that question until the end.
Well, it's going to be teased out
Okay.
through the video. So this is a very common thing. Lots of stuff on social media. Lots of confusion, I'd say.
Comment your answer now.
Yes.
If you think yes or no.
And share how much you're actually taking, because the numbers are going to be a wide distribution of the amount that people take.
This is a test with only one question on it, and we'll see if you get it right.
Okay.
Should everyone be taking a vitamin D supplement?
Okay, so we're going to start at the beginning. What is vitamin D? This is one of Paul's favorite answers. Okay, Paul, so what is vitamin D? Is it a vitamin?
No, it's not a vitamin.
That kind of bugs you right out of the gate.
It's not a vitamin. Because a vitamin is a substance that we can't make and we need to get from our foods. Vitamin D, we can make it. So why do you call it a vitamin?
It's actually a hormone, right?
There you go.
A cholesterol-based hormone. So let's talk about how vitamin D is made. So when sun hits our epidermis, or the most outer layer of our skin, it reacts with the cholesterol molecule that's there.
Yes.
And makes pre-vitamin D, essentially.
Right.
Then that little pre-molecule gets absorbed, goes by the blood to our liver, where it gets hydroxylated to another pre-form.
Right, it's pre.
25 hydroxy vitamin D.
Okay.
And then that goes to your kidney, where in the proximal tubule, 1-alpha hydroxylase, an enzyme, adds another OH group to it.
So now you're thinking, hey, what if I have kidney disease? Well, what happens to me if my kidneys aren't working?
Well, we're going to talk about that. So now you have 125 vitamin D. So you got 2 hydroxyl groups. This is the active form of vitamin D, or calcitriol.
Okay, so it's a process, right? What you take in isn't actually the vitamin. There's some processing that's required.
Yes, or even what you make or eat, for sure.
Right, and that is relevant too, because when you take a certain amount, that doesn't all turn into the vitamin D that you can use.
Okay, so I'd agree. So first we talked about if you make it, so we can end up in a common pathway. So what about if you eat it?
Okay, so that's where we're coming in with foods that have vitamin D.
Yes.
Or supplements.
Okay.
Typical supplements are usually vitamin D tablets that are characterized by international units.
Yes.
You'll see numbers like 400 international units, 800, 1,000, 2,000, 10,000.
Right.
There's a wide range of supplements available with vitamin D in it, but there's some foods with it too.
Right, so fatty fish mostly, and then some supplemented
Why are you making
milks.
fun of the fish like that?
Well, I'm just saying,
Okay.
they're thick.
The big boned fish.
Yes. Well,
Fish.
the bones, yeah. Okay,
Right.
so you can get it from fish, you can get it from milks. Probably can't eat enough of that stuff to meet your daily requirements, to be very honest with you. But regardless, that goes into your stomach, where your stomach breaks down, and in the intestines it gets absorbed.
Okay, and I see all this stuff about vitamin K. I got to take vitamin K. Do I have to take vitamin K to help it get absorbed?
Right, so so vitamin D, so you can take D2 or D3. D2 is a plant source, D3 is primarily an animal source. D3 definitely is better absorbed.
Yes.
Not even negotiable. So most of the supplements actually now are D3.
D3, sure.
That's just commonplace. K2, the role of K2 is whether or not when you take vitamin D, how it drives calcium, whether it puts it into the bones as opposed to into the muscles or the vessels. So I would say there's some evidence for this. It is not as convincing as everyone says online, so it's worth considering. But vitamin K does have some roles in clotting and other things. So you have to be a little bit careful, and it's not absolutely mandatory. But that makes people mad. They're like, oh, what about K2?
You're going to see a ton of stuff online about vitamin D. Oh, don't forget about the zinc. What's going on with the magnesium? What's going on? All that's, we're talking about vitamin D now on the backdrop that you're eating a healthy diet. Okay, you're eating a wide variety of fruits and vegetables, and you're getting your protein from different sources. So you have a healthy diet. So if you have a healthy diet, you don't have to worry about all that stuff that you see online about it messing up with your magnesium or your zinc or other things.
Agreed. One thing about taking a supplement, it's fat-soluble vitamin.
Right.
So we can store it. That's the first thing. The second thing is it gets absorbed better when you consume it with fat. So if you take it on an empty stomach or on a meal that does not have any fat, absorption is in the 20 to 40% range.
That's low.
Whereas if you take it with fat, it goes to the 60 to 80. 80% is kind of the upper limit of what they estimate we can actually absorb from a supplement. So even 5 to 10 grams of fat, like a handful of almonds kind of thing or whatever, or some type of other fat, that will increase your absorption and it would make sense.
Okay, and so It's fat soluble. A, D, E, and K are those fat soluble
Yes.
vitamins, and we worry about toxicity. We always say, "Oh my God, well, if it's fat soluble, we're gonna get vitamin D toxicity, vitamin D toxicity."
Yes.
That is incredibly rare.
Yes.
I think most physicians go through their entire careers never having seen a case of vitamin D toxicity.
Agree. I'd say there's an outside chance that it's going to increase in frequency because people in 2026 are extreme. So if someone says, "Oh, you should take 2,000," well, I'm going to take 50,000.
Yeah.
So there will
Fair.
probably be some people that do get it, but it is. I would agree with you. It's very, very
Yeah,
rare.
I think you'd have to take like on the order of 50 or hundreds of thousands every day for a few months before you see that. And
Right. Okay.
that's like a bottle a day.
And so to your point about kidney disease, if you're on dialysis, for example, your ability to convert any of that pre-vitamin D to vitamin D approaches zero. So those people, that's why people with kidney disease, we see them all the time.
Yes, we do.
They have very bad bone disease. Often they'll get hip fractures.
Yes, they do.
So this needs to be treated early and often with an active form already. So they kind of forget
so
that step.
We're starting to answer our question. Right?
Yes.
Those people who experience kidney disease should be on a vitamin D supplement.
Right, but not an oral supplement because it's not going to work. So they have a whole bunch of they can absorb it,
Yeah.
and their livers, if their livers work okay, they can get that first step. They just can't get the second step. So it would sit around for a while, and eventually it would be broken down, but it can't get converted. So yes, they would need a conversion of the active form.
Okay.
Okay, before we go on about whether or not everybody should have it, let's talk about the sun. So we live in Canada. So in the summer, our bodies can make a lot of vitamin D. Some people say that you can make even 10 to 20,000 international units a day.
Yeah. Outside in the sun.
Right, which begs the question: what's the RDA for vitamin D?
It's variable. I've seen numbers from 400 to 800. If you're under 1 year old, it's about 400. Anyone from 1 to like 75 is like 600.
Yep.
Over 70, 75, it goes up to about 800.
Yep.
We've talked about this before, though. RDAs, recommended daily intakes, are amount to take to not get certain diseases.
Like rickets.
Rickets, a bone disease caused by vitamin D deficiency rickets, that is a bone disease caused by vitamin D. We see more in developing nations than we do see here.
Right, so the RDA was designed to prevent disease, not necessarily to optimize health. So most people would say that if you're getting the RDA, it's probably not enough. And I'd say that's a trend. In order to optimize your health, most people would say 2,000, 3,000, certainly up and debatable.
Right.
But I think most people would agree that if you're going to take a supplement, or if you need a supplement, you should be taking more.
And we were talking about the sun, sun causing it. And then so some of the things that can stop the sun from doing it is don't go out in the sun. That stops you from getting sun exposure.
Right.
Living where we live stops you from getting sun exposure.
So let's talk about that. So the 37th parallel, which we are above, we're like 43-ish where we are. So anywhere above the 37th. So if you're in the U.S., so that's like Bakersfield, California, around St. Louis, Missouri, Louisville, Kentucky. So a lot further south than a lot of people think. So like half of Americans can't make vitamin D after, say, kind of October-ish to like April-ish. So a significant amount of time. The reason is, in the summer, the sun's a lot higher. So the UVB rays kind of more straight down. They spend less time in the atmosphere, so it penetrates further. As we get later in the fall and in spring, the angle of the sun gets absorbed. So the UVB rays get absorbed by the atmosphere, get scattered. So essentially no UVB is getting through.
Right.
So you physically, so here's a take home for your first hot take. If you live above the 37th and it's December, I don't care if you go outside in your Speedo on a sunny day, you're getting 0 UVB rays and subsequently 0 vitamin D.
Thanks to the Earth's tilt, that's where all that stuff happens. Do you think nudist colonies still exist?
I think they do.
Really?
I
like
would
a
think,
whole colony?
I would think they exist more than ever, actually.
they're
Wouldn't you
making-
think 2026 lifestyle kind of lends itself to, forget it, I'm not wearing any clothes.
I guess I'm getting my vitamin D where the sun don't shine. But
No,
now it does.
And actually, you can't get vitamin D where the sun don't. Well,
That's the thing.
yeah, it's the thing.
And now you're probably thinking, oh, well, you can't push and pull at the same time. You're telling us to get our sunlight, but then your other videos say, hey, put on sunscreen.
Okay.
Because you don't want to get skin cancer.
So that's a good point.
You'd be right. A lot of the sunscreens do block the UVB that we need.
100%. So if you put it on properly, you essentially would not be able to make any vitamin D. Often people don't reapply enough, or they apply improperly, so you can make some. You still could get sunburn. UVA is responsible for the sunburn. So sunscreen definitely can limit it. Darker skin tones can limit it. Even if you have a tan, actually tan skin makes less sun, or makes less vitamin D, than that white skin. So in the summer, if you are looking for some vitamin D, take that shirt off and show everybody your white belly.
Yeah.
And that's going to make more vitamin D than your tanned arms.
Join the nudist colony.
Right.
Okay, what
other
if
things.
I don't want to go outside in my Speedo? Can I just stand behind the glass window in my house
So you
on a sunny day?
You can. It's gonna damage your neighbors,
Yeah.
burn their eyes possibly. You might singe their eyes, but you're not gonna make any vitamin D because standard glass blocks all UVB.
Right. So it's really being outside in the sun,
Right.
in unprotected skin, that allows you to make the vitamin D. Which
Right.
we recommend against because of
Skin cancer.
cancer.
So sure, often you only need 10 or 15 minutes. So you potentially could get exposed, not get a sunburn, but you have to weigh the risks and benefits for sure. Other things that can prevent UVB from getting through even in the summer, really cloudy days, on a very, very cloudy day, could essentially get to zero. Smog, or even like forest fires. Like we've had a lot of forest fires in Canada, and a lot of smoke from the western forest fires.
Yep.
That can limit the amount as well.
It's early February here.
Yes.
It's minus 15 outside today.
Yes.
What's our UV index today outside?
Okay, so I looked, and it's actually 0.
Okay, there you
So
go.
0. So the UV index, I always thought it was just 10, but you know what?
This one goes to 11.
These go to 11.
Well, thanks, Spinal Tap. But actually, this one goes, they estimate the highest recorded, maybe 15 or a little higher in Australia in the summer. The highest ever seen in Canada is about 12. But yes, 10 is very, very high. And this is essentially the amount of time, the amount of UV exposure that you get because of the angle of the sun, the presence of clouds in the atmosphere, that kind of stuff.
Okay, so that's the sun
Yes.
factor that's going to do
I
it.
thought that was interesting.
That is fascinating. All right.
Okay, let's talk about what does vitamin D actually do? Why do we even care?
Okay, so we have good evidence for vitamin D and what it does to us
Okay.
because we're orthopedic surgeons,
Yes.
and not only because we're orthopedic surgeons. What it does to your bones is probably the most important.
We do
one
care
to
a
us.
lot about our bones.
We do. And that one seems to have the most evidence behind it that supports the fact that vitamin D is essential for bone health.
Agreed.
That's why it's one of the first line treatments for osteoporosis, a
Right.
disease that puts you at risk for fractures.
Right. The way it kind of works with calcium, not in isolation, but the two together, yes, for sure.
Okay, that's number one.
Okay.
Best evidence for that.
Number 2 for me, good evidence for muscle function. So vitamin D and calcium work together to allow muscles to contract.
Right.
So if you do not have adequate vitamin D and calcium imbalance, this can lead to dysfunction of your muscles.
Okay, fair.
Good evidence there.
Next one for me where there's still decent evidence is your immune system.
Yep.
It helps boost your immunity and helps you stop you from getting sick from infectious diseases and other immune conditions.
Yeah, specifically helps T cells, and we're learning more and more that like our gut is responsible for like 70% of our immunity in our gut microbiome video. We talked a little bit about that. So definitely immunity. I'd say those 3 are where the good evidence lives.
Yeah.
I'd say there's 3 others where there is a lot of thought that it might be beneficial, but more kind of correlation and association, not causation. So for me, number 1 would be cardiovascular disease and lowering your blood pressure. So having adequate vitamin D levels might reduce your risk of having hypertension.
Okay. The other one that there's some softer evidence for is different types of cancers.
Yep.
Maybe that's by way of the immune system. I don't know, but there's some softer evidence that it can reduce certain cancers.
Right, and the other one for me is mental illness. So depression, anxiety, seasonal affective disorder. Originally I thought it seems so easy to test. If you think it's seasonal affective because of vitamin D, just give them a bunch of vitamin D to go away. So they did these studies, and some say yes, and some say no. So it's, and like everything, it's not just one thing that's responsible for being sad or depressed or whatever. So on the mood side, we definitely think there is a role, but we're not exactly sure what it is.
If you suffer with that, try it. It may help you.
Yes.
Okay, so those are things where the evidence is good, evidence bad. Okay, can we get to the point now? Should we answer the question yet? Should
Yes,
everybody?
I think it's time.
Okay.
So I think the short answer is no.
No, not everybody needs to take a vitamin D supplement. Okay.
Okay, so who should?
All right.
Oh, one more thing I guess it's going to answer. Older people have worse absorption as well as worse conversion in their skin. So there's someone that may be on the list that Paul's about to start.
Okay, so let's say people and we're just pulling this out of thin air. This is actually the 2024 recommendation from the Endocrine Society.
Right.
That said, people over 75 should probably take a vitamin D supplementation to decrease overall cause mortality. Even evidence showed it decreases falls in that age group.
Right.
And cardiovascular disease as well has been shown in that age group.
Okay. So older people.
Younger people.
Okay.
We know we give them to infants under 1,
Right.
especially breastfed infants are always given a vitamin D supplement. And I would say anyone 0 to 18 years of age, those people probably should be taking a vitamin D supplementation.
Regardless of where they live?
Yes.
Interesting. Okay.
That's what I've seen in the recommendations.
Is it people that are not going outside?
No, it's
Oh.
just well, infants 0 to 1.
Yeah,
don't
they're
go
not going outside.
but they definitely.
What if they
should.
crawl outside?
They could crawl outside, but then there's a host of other problems.
The onesie probably
Dingoes
covers
got
them.
my baby.
And the onesies probably cover up most
Yeah,
of their
and the
skin.
dingo could get them.
Okay.
All right, and then now the question is, what about people like in that age group of 18 to 75?
Right.
Not everyone 18 to 75 should be taking vitamin D supplementation.
No.
We mentioned one already, people who experience kidney disease.
Right.
They get some form of vitamin D given
Yep.
to them.
People I'd say with liver disease, so kind of that first step, or I guess the second step. Kidney's the third step. Liver's the second step. So people with liver disease would have to consider and talk to their doctor about possibly doing it. And then maybe the first step. What about the GI side?
Malabsorption syndromes.
Right.
If you have malabsorption syndromes, that can do it. Or if you're taking medication that decreases absorption, things like anticonvulsant medication or corticosteroids.
Yep. I think even PPI. PPIs are they're on a lot of lists.
Yeah. Or people who've had surgical procedures that will decrease their absorption.
Like gastric bypass.
Yeah, like a Roux-en-Y bypass. So those people would definitely benefit from a vitamin D supplement. And then there's the rest of us who just don't get enough sunlight. So who are the people that don't get enough sunlight? And you mentioned the people who live north.
Above the 37th from October to April, you should be taking it.
Was that a Tragically Hip song?
No, that the 100th meridian.
100th
Yeah.
meridian. Close.
Where the Great Plains began.
Where the Great Plains begin, at the 100th meridian.
Okay, so that.
Rest in peace, Gordani.
And or if you're institutionalized, and you just can't get outside for whatever reason, you may benefit from vitamin D supplementation. Or actually shift workers, right?
Right.
Who are working all night, where
Right.
there's no vitamin D,
Yeah.
sleeping all day.
Yeah.
Vitamin D supplementation may be for you. So the answer to our quiz is no, not everyone on the planet should be taking vitamin D supplement.
No, but a fair number should.
Yeah.
Fair number should. And then just as we're just getting ready to finish, what should I test my vitamin D, doc?
Oh, that's a good question. So according to the Endocrine Society, no. Routine testing for vitamin D levels is not useful because we don't know what the right level is that correlates with disease.
Right.
So you're testing, but you don't know what the answer is,
Right.
right?
And I would say nowadays more than ever, there are lots of companies that are making a lot of money getting you to test all sorts of stuff and not really knowing what to do with the results.
We just don't know what the
We're
right
all
numbers
obsessed
are.
with data, and
So
there's that group that is like middle age and concerned about like their longevity, and they just want to test everything, and it's a big business, but you just have to decide, is it going to make you more anxious or is it actually going to help?
And I would say if you think you're someone that should be taking vitamin D supplement and you can afford it, then take it because it's incredibly safe taken in the sort of numbers that we've been talking about.
Yeah.
400, 800, 1,000, 2,000 international units.
Yeah.
It's very safe to take that amount. Oh, the other people I recommend it to is people who have fracture.
Right.
For healing fractures, I often will recommend it to
Right.
those people as well for a period of time. So personally, in the summertime, when I'm outside on vacation, I don't
Got
take
the
vitamin
guns out?
D. Yeah, when the sun's out, guns out. I don't take vitamin D.
Right.
When I'm at my nudist colony, no, we don't need it. However, in the winter time, I definitely take a vitamin D supplement.
I can't unsee that.
My nudist colony? I've never been to a nudist colony. I've only ever seen a nudist. I've seen nudist beach signs. Never been to one of those. I always see those in front. Have you
You're
ever
always
seen-
standing on the periphery
You see the
with your
nudist-
binoculars.
You see the nudist beach side behind you as you just walked on.
Never been to nudist beach.
So
I know.
that's basically my approach. So wintertime.
I'd like to apologize on behalf of our channel for you having to imagine Dr. Zalzal at a nudist beach.
Never been at a nudist beach.
Yeah.
But that
He
so
doth
that's it.
protest too much.
That's the deal. So you don't in the summertime when I'm getting sun, I don't take it. In the wintertime when I can't get enough sun, I do take it.
Yeah.
What do you do?
Same. Yeah, same. I'm outside a lot in the summer. All the summer, I'm not.
So you're not taking vitamin D supplements in the summer.
In the summer, I would not. Yeah.
Fair enough.
Interesting. I didn't know kind of exactly the timing of when the sun got strong enough to bake. So that was
high noon, I guess, basically.
yeah. And I mean more the time of year, like
Yeah.
October, because a lot of people think, oh, can I not just store it up all summer?
yeah. Oh,
You can for a few weeks and even maybe even months, but you don't know the exact amount. So you don't really want to store it up and then get deficient and then chase your deficiencies. So.
Is the best time noon or 3? I heard 3
No,
p.m.
so that's a good question. So I investigated this exact. So if you're using daylight savings time, which a lot of people, that gets a lot of people mad too. Daylight savings time, 1 p.m., non-daylight saving 12 p.m. That's when the sun is the strongest and you get the most UVB hitting your skin to make the most vitamin D. And often it's a very short period of time, like 10 or 15 minutes can make even 10,000 units.
Yeah, get out there for a bit, but then put your sunscreen on.
Put your sunscreen on. It's tricky.
Put your sunscreen on, but get enough sun.
Yeah, but don't put too much on because you want to make vitamin D.
We don't get skin cancer.
If you like this video, please like it, subscribe to our channel, leave a comment about Dr. Zalzal and a nudist colony, and
Let us know if you got the question right. Should everyone take a vitamin D supplement? Remember, you are in charge of your own health.
we'll see you next time.